Okay, so the next section we'll talk about is going to be dermatology. I will confess that I am no expert on dermatology. I barely understand my own skin, much less anyone else's. You don't see a ton of derm stuff. Well, at least from the pharmacist's perspective, you don't see a ton of it, like in the emergency room. Like it's pretty cut and dry for the most part. But I will do my best to convey this. If I don't know an answer to one of your questions, please we'll look it up together. How about that? I'm definitely fallible when it comes to this stuff. So we know the skin, it's one of the largest organs in the body, about 17% of our normal body weight. It really works as a very good protective mechanism, right? It's preventing all kinds of microbes and other kind of things from getting into us. And you'll see that the thickness of the skin is going to depend based on where you're at in the body. So the face, the scrotum, armpit, the scalp all have a little bit thinner skin, and that's going to be important when we're talking about things like drug absorption, right? Thicker skin, things like the palms, the soles of the feet, the forearm are less permeable. And so that's going to be important when we talk about things like side effects, when we talk about which type of medications we're going to use on the skin. The way that drugs are absorbed systemically is via concentration gradient for the most part. So there's this thing called Fick's law. We mentioned Fick's law last week. Fick's law is basically a law that talks about the passive diffusion, this aqueous diffusion that can occur across a membrane. And it's contingent on a couple different things. And one of them is the concentration gradient. So the higher the concentration gradient I have on the outside of a membrane, the faster the drive is going to be through that membrane, right? Because things like to go from areas of high concentration to low concentration, right? Kind of basic science. Other things that are involved with this are, one, the physiochemical actual permeability of the molecule itself. There are some things that are just, so either big or they are, hydrophilic enough to where they're just not really able to cross the skin barrier very well, right? So some drugs just don't get absorbed very well through the skin. Some are much more lipophilic, and they like to get absorbed much more easily. So that's another factor you look at. Another factor is going to be the surface area. So the more skin I cover, the more chance I have for the drug to be absorbed. Makes sense. And then also the other thing is going to be the actual skin thickness. So the thinner the area that I'm applying the drug, the better the flux I'm going to get through that membrane. Okay. So some of the things that I can change when I'm applying a drug to the body, I can change where I'm applying it, right? So I can maybe move it to an area that has thicker or thinner skin to change how well the drug is being absorbed. I can do things like change the concentration of the drug that I'm administering. That's going to be changing the concentration gradient between the outside to the inside. I can also change how much surface area I'm covering. And so that can be really important because you may have really big disseminated areas of disease that you're trying to treat, but if I cover your entire body with some of these medications, the systemic side effects from absorption is going to be such that it's not really going to be, the benefits don't really outweigh the benefits don't outweigh the risks from the toxicity. So we'll get into more details on that, but just be aware of the differences here. And it's also going to rely a lot on the vehicle that the drug is actually being put in. So whether it's an ointment or a gel or a cream or a lotion, we'll talk all about that in just a second. So you'll see some that are moistening, some that are drying, and also the occlusiveness. We'll talk about in just a second as well. So occlusiveness is basically how much staying power the product has. So if you imagine something like the alcohol hand sanitizers, right? Those kind of fly right off you, right? They evaporate very quickly. It's not very occlusive. On the other hand, if I had something like Vaseline, and you put it on your skin, that stuff, you can't get rid of it, right? You have that kind of that greasy feeling on your hands forever. That has much more occlusivity. It's able to be much more occlusive, and so things that have longer staying power have better absorption as well. Okay. So as you said, you have to consider the vehicles that you're going to be putting these dermatologic products in. So how soluble is a drug in the vehicle? If it's not soluble, it's not going to go into solution. Guess what? It's not going to get absorbed. And you're also looking at things like how to hydrate the stratum corneum. Depending on the skin condition you're doing, you may have very dry skin, you may have very kind of moist, oozing skin, and all of that can lead you to use a different dosage form in order to help kind of counteract that. Usually you want to have a nice hydrated stratum corneum because that's going to allow for better absorption of the drug through the skin. If it's all dry and scaly and really hard to get through, that's going to be a problem there. And then you also want to look at stability of the drug in their vehicle. So this is where you see things like preservatives, antimicrobial items are added in, all kinds of different things to make sure that the drug is going to stay sterile and stay stable within that that dosage form. So in general, when looking at dermatology, and this is how it was described to me one time, if it's wet, make it dry, right? So you want to use things, if the area is oozing, crusting, vesiculation, you want to use more drying type agents. If it's dry, make it wet, right? So if you're having a lot of scaling, xerosis, lichenification, you can utilize things that are more hydrating. You can utilize things that have better staying power. So things like ointments and creams might be better for those type of situations. I'll show you a graph in a second that kind of runs the gamut of all of these. You'll see things like hairy areas will typically require agents such as tinctures or lotions. They're a little bit easier to kind of get into the area, so that way it's actually making contact with the skin. Because usually, shaving is not always going to be a good option depending on where you're trying to apply it. Try to avoid things like ointments and creams. It's going to be much more difficult to make contact with the skin. Tincture, I will talk about that in a second, but basically it's a hydroalcoholic mixture, meaning it's mainly an alcohol-based product. So it'll be kind of a division between alcohol and water, but it'll have a higher degree of alcohol. And why would I have alcohol in some of these mixtures? Yeah, so sometimes it'll be to dry out the skin. What would be the other thing in regards to the drug? Not to activate it. It has some antimicrobial properties for sure. Solubility, though, is going to be the big thing. So drug solubility. So sometimes you'll find IV products that have alcohol in them in order to get the drug to go in solution. If you look at something like NyQuil, has alcohol in it, right? Because you need to get the drug into solution. Probably also helps you sleep a little bit when you have a cold, but that's the main thing. So again, you can see things like wet dressings can be utilized. They help provide some evaporative cooling. You can use them for nice inflamed areas. So you can see things like normal saline dressings. Acetic acid can help. Acetic acid is kind of an astringent as well, so it can help kind of pull the skin, kind of stretch it out a little bit to help there. And then also powders are good for drying because again they're powders, so again they're going to be very absorbent and they're good for cooling as well. Lotions are typically going to be, again, a lot of these are looking at the oil versus the water content of them, and so we'll see things will be oil and water emulsions, things will be water and oil emulsions. We'll talk about the differences there. Lotions are typically going to be less occlusive than something like a cream, definitely less occlusive than something like an ointment, but typically you'll see it being used for more things like drying and cooling, but it's usually a suspension or solution of a powder that's in a more water vehicle. So the water content is much higher for lotions than you'd see with something like a cream or an ointment. Solutions, again, kind of goes back to how well dissolved the product is within the vehicle. So things that are solutions are much more homogeneous, smaller particles of the molecules, versus suspensions usually have a lot bigger particles. That's where you can see things kind of falling out if they're in a suspension, if it's not a very viscous medium that it's in. So that's why you got to shake up certain drugs in order to make sure the drug is suspended all the way throughout. And then gels are typically going to be more alcohol-based, but they're usually non-greasy, non-staining, non-occlusive, and they're very quick drying. So if you're looking at the greasy kind of texture of it, usually things like ointments, maybe some creams are going to be more on that side, because usually you have more water and oil emulsions, versus when you get to like gels and lotions and solutions, you're going to have more higher water content, so you get less of that greasy feeling to it, right? But that also leads to less occlusiveness. Again, the emulsions we talked about, it's either an oil and water, water and oil. Again, it's going to kind of go back to a lot of the factors we talked about. Creams are probably going to be the most common vehicle you'll run into. Most of them are going to be oil and water emulsions, so water is going to be the predominant vehicle there. So again, really needs to be rubbed in until it's vanished, but not very occlusive. So it's going to be better for things like non-irritable dermatoses, non-acute kind of issues there. So most things will be creams, but we'll see certain areas where ointments and lotions might be better depending on the situation. Ointments typically going to be more water and oil emulsions. We kind of mentioned that. Then aerosols are good because you don't actually have to have direct contact with the skin itself, but usually they're more expensive. They're harder to get rid of from a waste perspective, and usually less efficient than other topical methods, but sometimes we'll see aerosols being used as well. So just to kind of give you an overview of things that are least drying to most drying, again, if you're having kind of a very wet kind of wound, oozing, vesiculation, you use things that are more drying, versus if things are more dry, use things that are least drying. So again, ointments are going to be better for more kind of dry, lichenification, things like that. Make sense? This chart, you don't necessarily need to memorize every single point of it. We talked about most of these. Just note that the higher the water content is in a lot of these products, the more likely you are to have bacterial growth, and so that's where you see things like antimicrobials added into it. You see things like preservatives. Usually, the higher the alcohol content, the less of that you need, because it has its own kind of antibacterial properties itself. But if you look here versus the cream versus the ointment, you see here the cream obviously has a higher water content than something like an ointment would. And you guys kind of know the difference in the feel between an ointment and a lotion and a cream, right? You guys all kind of felt that, sure. Maybe not the guys, but I'm sure the ladies at least know the difference. My wife knows the difference. I don't. But. Okay, so the first group, and probably the more common ones you're going to run into from the derm perspective, is going to be topical corticosteroids. So what's the most common one you guys can think of, if you've ever heard of one? Hydrocortisone cream, right? Everyone's heard of that, right? So this is going to be the drug of choice for all inflammatory and pruritic eruptions. If you're having allergic contact dermatitis, eczema, anything like that, usually topical corticosteroids are going to be kind of your go-to drugs. You'll see that there's lots of different preparations, and then you'll see lots of different concentrations. So you'll have 1% hydrocortisone ointment, 1% hydrocortisone cream, you have 2% cream, ointment, lots of different salt varieties, especially of hydrocortisone. And you'll see we'll talk about things that are low versus medium versus high potency corticosteroids. And as you might imagine, if you're using a more high potency steroid, what's your likelihood of having systemic absorption? Is it good or worse than using a low potency? Probably a lot better, right? It's also going to have much more of an anti-inflammatory type property to it. So, you're going to typically reserve your high potency steroids for really, really severe inflammatory reactions, and really be worried about the systemic absorption the patient's going to have, because you're going to see a lot of systemic effects from this, potentially. As far as contraindications go, you really want to avoid these in infectious disease states, because again, corticosteroids themselves have they kind of depress the immune system. So if I depress the immune system on these infectious diseases, my immune system is not going to be able to really clear those as well. So you don't want to use it then. So fungal infections, warts, things like that, topical steroids are not going to be good. Even if it is kind of inflammatory in nature, these are not going to be good for that. As far as local reactions that you'll have from the steroids, you can see things like dermal atrophy, fine hair growth, bruising, some striating in the skin. Again, the more skin area that you're covering, the higher the concentration of drug you're using, the higher potency steroid you're going to use, the more likely you are to see these local side effects, right? There's also going to be a host of systemic side effects we'll talk about as well. You can see with more absorption. Just to give you an example of the different varieties of hydrocortisone you can run into. Again, I don't even bother remembering the brand names because there's so many different varieties, but creams, ointments, lotions, gels, anything you want, you can probably find a hydrocortisone preparation of it. I'm going to roll on stick if you prefer that. So how do you choose which one do you want to use?
Severity of the condition?
Severity of the condition, that's going to be a good one. So the severity of the condition is going to change what kind of recommendation, like what component? Yeah, percentage, absolutely. Location? What does the location have to do? Okay, good. So, what's the problem with if I put some of these on more thin skin? Exactly, I'm going to get more absorption. So, if I use a high potency steroid, that could be a problem, right? And then again, looking at whether you use ointments, creams, lotions, it goes back to is it really dry skin you're dealing with? Is it really moist skin? All those things. Using more dry or least drying dosage forms based on what the patient's skin actually looks like. So again, applications usually going to be more frequent. So if you're using things that are more water-based or have less occlusiveness, you typically need to apply them more frequently because they don't really have as good a staying power. So things like ointments can stick around for longer, potentially can be applied less frequently. Typically, you're going to start out with the least frequent dosing possible and kind of work your way up to get to a point where you're having relief of the symptoms that they're having for the most part. Again, you'll see in some cases, we'll talk about some of these a little bit later, where you can have patients using different strengths during different points in the disease state. So if they're having a flare-up of their condition, then you can use a higher potency or a higher strength concentration to deal with that acute inflammation. And then they might be using a lower potency or lower strength product for kind of chronic management of their inflammation. So sometimes you'll see different products being used within the same course of a disease state. Again, when you're looking at where you're putting these, if you're applying it to any thin areas, so things like the skin, the armpits, the the scrotum, anywhere like that, you always are going to run the risk of having more absorption. So things like using low potency steroids is going to be more prudent in those situations. So especially like the face, utilize low potency products. Versus if you're using it on more kind of thick skin areas, you can get away with using medium or high potency product if needed. I actually have a really good story about transcutaneous absorption of drugs. Working at the poison center, you get all kinds of oddball calls, but we had one kid who I believe was probably, say, like 8 months old. And so the dad had all kinds of chronic pain issues, and so he had this custom compounding cream that his pain doctor had written for him. Basically included things like amitriptyline, which is an old school SSR or old school antidepressant. Things like ketamine. Has everyone heard ketamine before? It's like horse sedative, right? All kinds of different products that were included in this cream. And so baby had just taken a bath. Mom was getting the kid all ready to go. Kid had really bad diaper rash, so mom said, "Okay, well, I'm gonna go ahead and apply this cream." So she grabbed the wrong one, grabbed dad's back rub cream, and basically just slathered all of the baby and put a diaper on. So you notice some of the problems there. For one, this kid's got really irritated skin to begin with because he's got diaper rash. That's going to increase blood flow to the area, increase absorption. Baby skins are typically thinner or thicker than adults, a lot thinner, so that aided absorption as well. You also have, sorry?
And then it's occluded by the diaper.
It's occluded by the diaper, absolutely. That's a huge thing as well. So it really had nowhere to go, basically. Exactly. Yeah, exactly. And the baby just got out of the bath, so it was warm and was getting good blood flow to the skin. So basically, mom came back in later, thought the kid was laying down for a nap. I found the kid apneic. Went ahead and had to intubate the kid, bring him into the pediatric ICU. Fortunately, the kid did fine. But just to show you, even though a lot of those drugs we don't apply dermally, we were able to do blood levels to actually get a lot of levels of the medications that he was actually absorbing through the skin. So be aware that even though it doesn't seem like something that should be a topical product, you can still get decent absorption of it if you're in the right settings. Yes?
I had heard a similar story. Gymnast, I think it was having really terrible shin splints, and she was using Bengay, and then she was wrapping it with a peace bandage, and she ended up passing away because the toxicity of the Bengay was so high that it killed her.
Yeah, so I mean, it could have been related to like the salicylates in the product or something like that if they're absorbing a decent amount. So, yeah, so just be aware that you can have some serious drug interactions or adverse effects that can happen from this stuff. So it's something to definitely take seriously. Again, typically you're going to see that the ointments are going to be more potent than your creams, basically because of that occlusive nature of them. And they're typically better absorbed because they're no higher kind of lipophilic kind of medium. You'll have better absorption through the skin because of that. And again, just like we said, avoid applying high potency agents to thin skin areas. So looking at the different agents, this is not an all-inclusive list. There's many other varieties that are out there, but I focus on the more common ones. So certainly hydrocortisone would be considered to be our lower potency corticosteroid of choice. See it usually come in a 1% variety, but certainly there are others that are out there. Keep in mind you will see other types of hydrocortisone salts that are available. So something like hydrocortisone valerate, even though it's only a 0.2%, a solution, you're still going to end up having this work more like a medium potency agent than you would see with the typical hydrocortisone acetate, right? So be aware of the differences there. Make sure you look that stuff up and make sure you're dosing it appropriately. Triamcinolone is a good example of a medium potency agent. Again, this is going to be used for more significant inflammatory conditions, so see more like psoriasis, dermatitis, eczema, things like that. Fluocinidine is probably a more common high potency agent you'll run into. And again, this is going to be for lesions that are really resistant to even the medium potency ones, or if you're having a very significant flare-up of disease, this might be a good option to go with there. And then you have an ultra high potency one, clobetasol. And again, at this point, like you're using such a high potency agent that you probably shouldn't be using in the primary care area, or going to be relegated to really severe inflammatory conditions in the dermatology office. Yes?
Oh, I was just curious because I don't see the percentages changing, just it's the actual chemical that...
The actual drug itself, yeah. Yeah, so you may have the same chemical percent, or the same percentage, but the drug molecule itself is changing. So what if you can't get away with utilizing glucocorticoid? There's a lot of potential reasons why you might not be able to use those. So say, for instance, you had a patient who's immunocompromised, that they were, you're worried about worsening that with kind of large absorption of glucocorticoids, especially if it's a very diffuse kind of disease. You may need to cover a large part of the body, which can lead to more absorption. We have some topical immunomodulators that kind of get around this problem because they're working in a more kind of targeted approach than something like glucocorticoids. Glucocorticoids, we'll talk more about them in various disease stages, but they're working at the nuclear level to decrease transcription of a lot of inflammatory mediators, right? So they're stopping inflammation from the very top of the pyramid, so to speak. So they're very, very potent at stopping inflammation. Using something like some of these agents here, they're a little bit more targeted, so you don't see as a profound effect on the immune system as you would see with some of these other ones. So the two ones here that we'll see used include pimecrolimus and also tacrolimus. Tacrolimus you will see used orally for prevention of rejection of organs. So sometimes you'll see that used in post-transplant patients. But essentially what they're doing here, and again the conditions you'll see them being used are very similar. So again, for things like atopic dermatitis, chronic inflammatory skin disease, this isn't for simple contact dermatitis that happens every once in a while. This is more for more chronic conditions. But they're going to be working by inhibiting T cells, mast cells, and other keratinocyte activations to help prevent the inflammatory cascade from kind of continuing. So they have a little bit better side effect profile than a lot of topical steroids. You don't see the skin thinning, the atrophy, the skin discoloration that can happen from that. The other things you worry about, especially with systemically absorbed steroids, is you have this adrenal suppression that can happen. So you really don't run into that problem here as well, right? Because if your body's getting exogenous steroids, your adrenal glands are going to say, hey, I don't need to produce anything, and so they'll start to see that suppression happen there, which can be a problem. So don't really see that with these agents. You'll see that tacrolimus is pretty comparable to some of your medium potency steroids, and pimecrolimus is more comparable to some of your low potency agents. These do have their own side effects to be worried about. So one of these include pretty significant skin burning and warmth in anywhere between a quarter to half your patients. Some people worry about a risk of cancer. You may only see oral tacrolimus, so don't worry about it with the topical version. And then you also will see a lot of photosensitivity. So definitely make sure they're wearing high SPF sunscreen. Make sure they're covering up, especially if you end up working in Florida. The sun's going to be pretty significant out there. And the patients who already have a weakened immune system, this might be ones to avoid as well, since that can lead to secondary infections. It won't be as significant as you would see with the glucocorticoid necessarily, but you do want to at least be aware of that risk there. So again, this can be considered first-line therapy. They're considered steroid sparing, so these can be used instead of steroids for patients who cannot really tolerate those agents, right? So these are good alternative agents if they can't receive steroids.